A survey about men's health care published in the March 2011 issue of Esquire Magazine confirmed what women have always suspected. Men put too little importance on their own health. The Esquire survey reveals that 45% of men between the age of 18 and 50 do not have a primary care physician. 34% have not gone for an annual exam in more than a year, and 70% of those eligible have never had a prostate exam.
Why do those numbers matter so much? We talked to the specialist at the Waterman Cancer Institute about early detection and new advances in the treatment of prostate cancer, the most common diagnosed cancer specific to men in the United States, according to the CDC.
Well, the most common cancer that we see that men get is prostate cancer. And prostate cancer affects close to 300,000 men in this country every year. The key to being successful in treating prostate cancer is catching it early. That's an area of, PSA screenings is an area of controversy. It depends on your family history. If you have a family member who is a first relative who's had prostate cancer, namely a father or a brother, you probably should start your screenings earlier. And many urologists recommend you start your PSA around the age of 30 in that case. Most men will start their screenings around the age of 40. And so that's done typically once a year, once every other year, depending what their PSA is. There's several options that patients can have for treating prostate cancer. You can treat those with surgery, and usually those are well-selected patients who have good health, usually often less than the age of 70. Those patients could also be treated with radiation therapy, and radiation therapy can be done in a couple of ways. One is to use radioactive seed implants, which can be permanent, and those radioactive seeds are placed into the prostate gland to deliver a high dose right to the prostate. That is an outpatient procedure. It's done once, and it's very effective for what we call lower stage intermediate risk and low risk cancers. For patients who have a little bigger cancers or are a little more aggressive under the microscope, we recommend they be treated with some component of external beam, if not all external beam. And the external beam technique that we use is image-guided, intensity-modulated radiation therapy. And that allows you to deliver a very high dose to the prostate gland utilizing sculpted radiation therapy, so you can deliver treatments very precisely to the prostate gland and minimize dose to tissues around it, like the rectum and the bladder.
Our overall mission for the Cancer Institute is to assure that whatever a cancer patient needs once they're diagnosed, and diagnosis is part of that service, that we can provide them with the clinical research, the treatment outcomes, the support services, survivorship, and ongoing lifetime support to them as a cancer survivor.
We've included a link to the CDC's list of the 10 most common cancers in men, along with links for prostate cancer awareness with this story. You'll also find more information about our host location this month, Waterman Hospital's Cancer Institute, when you click the Men vs. Cancer story on our homepage at yourhometownhealth.com.